because really that's who we're talking about right now when we're discussing the role of biomarkers in patients with diabetes. We articulated in this document, we put in the document that an elevated BNP or NT-proBNP was part of the defining criteria for the presence of heart failure. And notice the cutoffs are much lower than we use in acute hospitalized patients, seen on the right side there. So really, when we're talking about the role of biomarkers in the office, when we're screening individuals, they're much lower values. And indeed, in the universal definition, an elevated NT-proBNP or BNP is part of the definition of stage B heart failure now. This is a long introduction for justifying why it is so interesting how natriuretic peptide measurement in type 2 diabetes has become such a hot subject. So how did we get here? Well, there are now many studies that have shown results such as I have on the screen here, which is to say that in individuals without prevalent cardiovascular disease, in other words, people who have no obvious heart failure with type 2 diabetes, natriuretic peptides have repeatedly been shown to be among the strongest predictors of incident heart failure or other cardiovascular outcomes. In this study, NT-proBNP was compared to hemoglobin A1C. Now you could say, well, why would you do that? Because hemoglobin A1C is not a biomarker of heart failure. But again, since we know that underlying structural heart disease, including diabetic cardiomyopathy, is strongly associated with poor glycemic control, it's worthwhile to look and see what natriuretic peptides bring relative to A1C. And you can appreciate how either a baseline or a rising natriuretic peptide value is very strongly associated with the likelihood for onset of cardiovascular events, including heart failure. Now, what about microalbumin? Of course, we will always continue screening our individuals for diabetic kidney disease, measuring albumin in the urine, and urinary albumin-creatinine ratio has been repeatedly shown to be associated with heart failure. And I showed you those curves earlier on, the intersection between cardiorenal disease and the likelihood for heart failure. These are data now comparing NT-proBNP